Grand Bassa County is one of the most populated counties in Liberia. According to Liberia's 2008 population census, the total county population is estimated at 236,912 inhabitants. Grand Bassa County has one of the weakest and underserved health structures in Liberia, and the county is also one of the counties in Liberia with strong traditional and cultural beliefs, which contribute to the use of herbs in some remote parts of the county. This led to the widespread of the Ebola virus disease in the county during the outbreak in 2014.
The area we work is an area that is known for strong herbalists. And Clayston had a famed herbalist there who died, but people used to come from all over Monrovia to go there for treatment. So people see most diseases as curable by him instead of the hospital. So they preferred doing their herbal treatment and going to the hospital.
It is against this background, serving humanity with affection, love, and an open mind, SHALOM was elected as one of the 3 organizations implementing the Ebola Community Action Platform Phase 2 ECAP project under Mercy Corps management, funded by the United States Agency for International Development, USAID, OFDA, across the country in 1,500 communities in 15 counties.
SHALOM Incorporated was one of the partners for Mercy Corps implementing the ECAP project operating in 15 counties. But for SHALOM, we were specifically given Grand Bassa County as one of 3 partners operating in the county. Conclusively, we helped to build the preparedness of community level against possible future outbreaks of Ebola virus disease, what we call the EVD, and other related sicknesses that community dwellers were being challenged with. And some of those issues had to do with vaccinations. Community dwellers in the district, especially those hard-to-reach areas, were not accessing clinics. And so the children under 5 were not being vaccinated.
What SHALOM is doing, as spelled out in the project, is to go in the communities and build community resilience. Help the structures in the community to be able to respond and prevent diseases of the same nature as Ebola. So SHALOM worked in about 74 communities in the Tubmanville area. All these communities are part of a catchment. The catchment refers to communities that are coming to this particular clinic. And the clinic we're dealing with was Tubmanville Clinic. So these 74 communities created 74 community health committees. And these committees, their job was to go about in the community, raising awareness on diseases, giving tips on how to deal with the community health situations, creating a community health risk reduction plan, and encouraging people to go to the clinic.
The Ebola Community Action Platform helps us in many ways. When they come, he will teach us how to clean our community, how to take sick person far away from you. When somebody is sick, you must make sure to take them to the hospital.
They help a lot talking to us about the Ebola, how when someone dies, you should go and get in contact with the health.
The goal of the ECAP project was to build preparedness at the grassroots level against a possible future outbreak of the Ebola virus disease and other diseases with similar symptoms. In Grand Bassa County, the mission of SHALOM was to reduce human suffering and ensuring human dignity through humanitarian services for the most vulnerable, especially women and children, psychosocial care and support for HIV/AIDS positive children and other vulnerable groups, provision of adolescent sexual reproductive health and rights-based education and services to adolescent girls, and advocacy for the promotion of children and the promotion of health-related messages for communities across the country. were also services being provided by SHALOM Incorporated under the ECAP project. Topmanville Township is a rural community in Grand Bassa County with an estimated population of over 7,000 inhabitants. It hosts several traditional schools. Since October 2015, SHALOM has been working in the health catchment that hosts the Topmanville Clinic with the objective of strengthening community platforms for sustained improvements in community health and increased preparedness against future Ebola virus disease outbreaks and diseases with high morbidity and mortality rates. SHALOM has helped re-establish community health committees, and in some cases where there were none, it supported communities in creating community health committees, CHC. Madam Florence Menwe is the officer in charge of the Topmanville Clinic. She has been at the clinic for 3 years and has not witnessed anything like the ECAP project that is mobilizing communities in such a unique way.
SHALOM intervention in our community have a great impact in our community because when SHALOM came around, SHALOM came at a time we just came from the crisis, and that was the time where we never have CAC structure in our rural community and that of CADC. But through their effort, our rural community have now CAC and that of CADC structure in 74 of our catchment community in the Topmanville Township. The Ebola Community Action Platform have an impact in the sense that when SHALOM came around, after they have structured the CADC and that of the CAC, they went from community to community. They have some of them trained on how to get health talk on the, like where they taught them on day-by-day management, where somebody died. They should be able to inform the health worker at the facility without touching the body. And they also taught them how to make use of the clinic, that they trust and use of clinic.
The last time SHALOM came, and they went to us and they trained us so we can be able to help our own community, and that the job will carry on. Presently, we are going around educating our people, tell them to go to hospital when anybody sick, keep a sick person aside from the family.
Although the project has ended, they're going to an end now, but now we get the experience that the people that went on the training, they will still be talking to us how to take care of yourself. When someone is sick, how for you to go there, what for you to do before entering our house to speak to the person. You should wash your hands. After speaking to the person, you wash your hands and you come outside.
At the start of the project, SHALOM recruited and deployed 18 community support officers to work in 74 communities in the Topmanville Township and parts of District 3 in Grand Bassa County. The coordination of civil society network, creating and strengthening health learning system, strengthening community health groups, establishing community health committees, now serve as a bridge between communities and the Ministry of Health community health service structures, and increase public awareness and knowledge are other areas SHALOM focused on during the project lifespan. Despite the gains made by SHALOM Incorporated during the project, several challenges were encountered during a year of implementing the ECAP project.
Initially, the major challenges we had were encouraging the communities to engage with the facility, because at some point down around the line, there had been this disconnect, because when they, according to the one community, when there were distribution, there were communities on the road and left the communities that were hard to reach out of the distribution of anything that came to the clinic, so the people felt left out. The other thing, the distances to some of these communities are very hard to reach. And even motorcycle, there's no room for motorcycle. They're very remote communities, and to get to them all the time was actually very difficult at times. And with water swelling during the rainy season, that also became a problem. But good thing the project period, there was no heavy rain that could prevent us from working.
SHALOM Incorporated remains grateful to Mercy Corps and her donors USAID OFDA for the opportunity to implement this project that has built resilience against Ebola and other diseases in communities in Grand Bassa County. With the project coming to an end, SHALOM Incorporated can now boast of its true meaning, serving humanity with affection, love, and an open mind.